Progressive supranuclear palsy, or PSP, is a rare and progressive brain disorder that affects movement, balance, eye movements, and thinking. Often misdiagnosed as Parkinson's disease, PSP progresses more rapidly and presents with distinct characteristics. This video will explore the intricacies of this challenging condition, providing a deeper understanding of its causes, symptoms, diagnosis, and management. The exact cause of PSP remains unknown, but research suggests that it results from the gradual degeneration of brain cells in specific regions, particularly the brainstem, basal ganglia, and frontal lobes. While it's not considered directly hereditary, genetic factors may play a role in increasing susceptibility. Abnormal accumulation of a protein called Tau within brain cells is a hallmark feature of PSP, but the trigger for this accumulation is yet to be fully understood. No specific environmental risk factors have been definitively identified, making prevention strategies challenging. At the cellular level, PSP involves the accumulation of abnormal Tau protein in nerve cells, forming neurofibrillary tangles. These tangles disrupt normal cell function and ultimately lead to cell death. The affected brain regions, including the substantia nigra, globus pallidus, and superior colliculus, control vital functions like eye movement, balance, coordination, and cognitive processes. As these regions degenerate, individuals experience the characteristic symptoms of PSP, such as difficulty with eye movements, postural instability, and cognitive decline. PSP is a relatively rare disorder, affecting an estimated 3 to 6 people per 100,000 worldwide. It typically appears in late middle age, usually after the age of 60. Men are slightly more likely to be affected than women. Due to its similarity to other neurological conditions like Parkinson's disease, PSP is often underdiagnosed or misdiagnosed, leading to delays in appropriate management and support. The signs and symptoms of PSP vary from person to person, but some hallmark features are common. Early symptoms may include loss of balance, leading to frequent falls, often backwards. Stiffness and slowness of movement, similar to Parkinson's disease, are also common. However, a key differentiating factor is difficulty with vertical eye movements, particularly looking downwards. This can make reading or navigating stairs challenging. Other symptoms include slurred speech, difficulty swallowing, changes in personality, such as impulsivity or apathy, and cognitive difficulties affecting planning, problem-solving, and decision-making. The combination and severity of these symptoms will vary amongst individuals. Diagnosing PSP can be challenging, especially in the early stages. There's no single definitive test, so diagnosis relies on a clinical evaluation by a neurologist experienced in movement disorders. This involves a thorough medical history, a neurological examination to assess motor skills, balance, eye movements, and cognitive function, and often, brain imaging. MRI scans can help rule out other conditions and may reveal specific patterns of brain atrophy characteristic of PSP. DAT scan, a type of nuclear medicine scan, can help differentiate PSP from Parkinson's disease. Neuropsychological testing may also be used to assess cognitive function and identify specific areas of impairment. The diagnosis of PSP is often based on established clinical criteria, which consider the presence and severity of specific symptoms over time. While PSP doesn't have formally recognized types, in the way some other diseases do, there are variations in how the condition presents itself. Some individuals may experience more prominent motor symptoms, such as balance problems and stiffness, while others may exhibit more cognitive or behavioral changes early on. Some researchers have proposed sub-classifications based on the predominant symptoms or the specific brain regions most affected, but these are not yet widely used in clinical practice. It is most important to recognize the individual differences and tailor treatment to specific needs. Currently, there is no cure for PSP, and no treatment can slow its progression. Management focuses on alleviating symptoms and improving quality of life. Medications used to treat Parkinson's disease, such as levodopa, may provide some benefit for stiffness and slowness of movement in some individuals, but the response is often limited and short-lived. Physical therapy can help improve balance and mobility, while occupational therapy can provide strategies to adapt to daily living challenges. Speech therapy can address speech and swallowing difficulties. Assistive devices, such as walkers or wheelchairs, may be necessary to maintain mobility and prevent falls. Botulinum toxin injections can be used to treat involuntary muscle contractions, such as blepharospasm. Supportive care, including nutritional support and management of bladder and bowel dysfunction, is also essential. Unfortunately, because the exact cause of PSP is unknown, there are currently no known ways to prevent it. Research efforts are focused on understanding the underlying mechanisms of the disease, including the role of Tau protein accumulation, with the hope of developing preventative strategies in the future. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, may promote overall brain health, but there's no evidence to suggest this will directly prevent PSP. The prognosis for PSP is generally poor. It's a progressive disorder, meaning that symptoms worsen over time. The rate of progression varies from person to person, but on average, individuals with PSP survive for 5 to 10 years after diagnosis. The leading cause of death is often complications related to falls, pneumonia, or swallowing difficulties. Recent research efforts are focused on developing new diagnostic tools and therapeutic strategies. This includes investigations into potential drugs that target tau protein accumulation, as well as clinical trials of symptomatic treatments. Advances in understanding the genetic and molecular mechanisms of PSP hold promise for the development of more effective therapies in the future.